Hey guys, I wanted to make this video to talk about the spread and progression of the coronavirus, just so that we can begin to get some more facts out there for how this virus is spread between humans, so that hopefully we can begin to calm down a little bit and at least feel more confident that we know what's going on. And so the terminology that scientists are using is COVID refers to the disease that is caused by this new coronavirus. And then a coronavirus is a generic class of viruses that have these spike proteins on the surface, which make them look like little crowns under a microscope. So that's the reason why we refer to them as coronaviruses. These are using RNA as a genetic material for the virus, and the technical term that we use to describe the coronavirus in literature is SARS-CoV-2. And so the key thing to take home here from all the literature that we have is that this virus spreads through droplets and surfaces, and you need to be within 6 feet of someone who is infected by the virus in order to get this disease. And what this means is that if you were on an airplane and someone with the coronavirus was at the front of the plane and you were at the back of the plane, which is more than 6 feet, even if that person is coughing and sneezing all over, you being at the back of the plane, being more than 6 feet away from that infected person, means that you will not get this virus because it is not airborne. It is only transmittable through surfaces or droplets. So unless they like cough or sneeze onto your face, and the whole reason why we keep telling people to not touch your eyes, nose, or mouth is because these are all the sites of entry for these types of viruses. So as long as you keep yourself protected, as long as you keep your distance from other people, as long as we avoid large public gatherings with high densities of people, then things should be okay. And so, take home message from that: avoid touching your eyes, nose, and mouth, and your face, because this is going to be a great area for transmitting this disease. It's how the virus will actually get into your body. In terms of death rates, again, this virus, even though it's scary, it is not as lethal. It doesn't have as high of a fatality rate as SARS did, which was 60%. This virus, based on the current data that we have available to us, has a fatality rate of approximately 2%. And some scientists and physicians are saying that this number is likely an overestimate, because the number of cases that we've actually confirmed of coronavirus are significantly low. And so as we roll out more tests and we realize that more people who have coronavirus didn't actually die from it, we're going to be making that fatality rate even lower. And people are guessing it's probably around 1%. So 1% chance that if you are infected by the coronavirus, you will die, based on our best guesses at this time. In terms of what is it like when you actually get the disease, what we find is that from around day 0 to day 5, most people are asymptomatic. This is the incubation period in which the virus has infiltrated your body. It has hijacked some of your cells. It is beginning to proliferate, use that cell's machinery to make many replicas of itself, and then make that cell burst, buds off, goes and infects more cells. And during this first 5 days, you're not really feeling anything. And then once you get to around day 7, for some patients, this is when you get an intense respiratory illness, or pneumonia, and this is where some patients can end up dying, especially people with higher concentrations of ACE2 receptors, which is found in older patients. And then generally, by the time you get to day 11, if you're still alive and you've been infected with the coronavirus and it's been confirmed that you have the coronavirus, you're going to be okay, or most likely you're going to be okay. And so the previous versions of MARS, or of the coronavirus that we've seen in the past, were the Middle East respiratory system virus in 2012, as well as SARS in 2002. So this isn't the first coronavirus that we've seen, and also the common flu is another form of the coronavirus. Just to add some perspective into what we currently know. We don't yet have any drugs or vaccines for this virus. Scientists are still trying to figure out a potential vaccine in order to help your body's immune system combat this illness. We are still learning about it. The current way that we even test for the coronavirus is through using PCR. We essentially amplify the genetic material that the virus has infected your cells with, and then we have primers that will help us recognize if you have that particular viral genome or genes inside of you, then we can confirm you as a positive patient for having the coronavirus. But these tests are slow. They take more than a few hours, and then in addition to that, the other problem is that they are one-time point, and so that depending on how infected you are by the virus, the amount of RNA that would be available for us to test is going to be fluctuating. It's going to be a volatile number. So these tests being snapshots in time are not necessarily good or reliable indicators. So we are still working on determining what is going to be an effective, rapid way to reliably detect people who are infected with the coronavirus. So people are making progress in that. And then in addition to that, what are healthcare professionals doing? People who are constantly in contact with several patients who have the coronavirus. In that case, or in these cases, people generally get away with just using, gowns, gloves, face shields, and they use N95 respirators. So the healthcare professionals are using these things in order to prevent themselves from getting infected by this virus, and it is sufficient for them because this virus, again, is spread through droplets or surfaces. So as long as you have that face shield, in theory, if none of the viral particles make it onto your face, onto your eyes, nose, or mouth, then you won't be infected by it. And so that's the key thing to take home from this, is that this virus is spreading by these physical means to other people. And so as long as we keep our distance, as long as we practice the social distancing that is being advocated to us by our healthcare professionals and experts, we will get through this. The rates of new infections should begin to decrease, and that is going to wrap things up for this video. I hope this video helps ease some people's minds about this coronavirus, and know that we are working very hard to develop vaccines and more reliable and quick methods for screening if people are infected with it. We are working very hard at this. I hope that everyone out there stays safe, takes care of your loved ones and your family, and please, do your best to just keep going and stay positive, and know that we've got a lot of very smart, brilliant, passionate people working on this very diligently right now to make sure that we get through this as safely and quickly as possible. So that's going to wrap things up for this video. I wish all of you a wonderful night, and take care.